Hi, my name is Rodrigo Kong. I'm an emergency medicine physician at Staten Island University Hospital.
And I'm Dr. Anna Van Tile, also of Staten Island University Hospital. And today we're going to demonstrate how we create the Van Kong fenestrated drape for intubation of confirmed or suspected COVID patients.
First, let's go over the materials. What you'll need to make the drape are plastic tub liners, some microfoam tape or any 2.5 to 3 inch tape, a pair of scissors or a scalpel or a box cutter, and a measuring device like a ruler or a tape measure.
We chose the tub liner because it's thin and clear. Just about any plastic sheeting will do, as long as it's thin, about 2 to 3 mil, and it has to be clear. You have to be careful because many are advertised as clear but are actually translucent. Based on our prototyping, the most useful dimensions of the drape were 5 feet by 7 feet. The tub liner comes in a 10-foot by 8-foot sheet. So our first step was to carefully unroll it in this long dimension and then fold it and cut it in half so that we have 2 sheets that we can turn into drapes.
So first, just open it up halfway. Having it on a big work surface helps a lot. From here, this is going to represent the head of the drape. So you would measure down 2 feet this way, and then I'd mark off 2 feet.
The fenestrations are located 2 feet down from the head of the drape. It's important that the fenestrations are centered on the drape and that they're 15 inches apart. To do this, we folded the drape in half and we measured from the center rather than measuring from the edges. Since the sheet is folded in half, the distance from the center to the fenestration is about 7.5 inches, which we measured out. Here we placed a pre-cut piece of tape that's 11 inches.
That's where your piece of tape is going to go.
Then the drape is flipped over, and a second piece of tape is placed on the drape, visually aligned with the first. Once the drape is opened, the fenestrations will then be about 15 inches apart and centered on the drape.
Then you can open it up, and you have your template. The next step is to cut the fenestrations, pinch it in the middle, and then cut out either way, leaving a little extra so that the corners are reinforced. When you cut, you're cutting through the tape and the plastic itself. So now this first drape is going to serve as a template for your next drapes. So now I can take the piece that I had from before, line it up, and then rather than having to measure everything out again, I can use the bottom drape as a template and just align my tape with a template below. Similarly, when I go to cut, pinch, and then cut. So you could use a scalpel or a box cutter to do this, but you would need a cutting board or some hard surface underneath.
This is the final product. Thank you for watching our video. Please send us any questions, comments, or suggestions.